I was talking today about the potential for polygenic risk in personalising cancer screening programs, with particular focus on personalising breast cancer screening by mammography. In the last 10 years, we have identified nearly 100 variants across the human genome that are associated with differences in risk between individuals. So these are variants that you can inherit that affect your risk of cancer, in this case breast cancer. And because these variants can be common in the population, some people have multiple variants, and so polygenic risk is the risk associated with carrying lots of different variants. So three main reasons. The first is that it's my area of research interest, so I know the most about it, but breast cancer is particularly relevant for this. One is because it's the cancer where we've found the most genetic variants associated with risk, so the potential for polygenic risk stratification is perhaps the greatest. And secondly, there's an established breast cancer screening program in the NHS and also in many other health systems, and so the potential for stratified risk screening is perhaps more relevant, especially as there's been a big debate in the last 20 years about the value of breast cancer screening by mammography. So the clinical benefits are that we know that breast cancer screening and other cancer screenings are associated with benefits and harms. And the major benefit is a reduction in cancer-specific mortality. But the harms can be quite serious in that there can be overdiagnosis, which is the diagnosis of cancers that would otherwise never have occurred in somebody's lifetime, and treatment of those cancers that is effectively unnecessary. And the idea is that if we could identify groups of the population that were at higher or lower risk than average, the benefit to harm ratio of screening might be improved. We haven't established kind of scientifically that that's true. It's just something that has potential and needs a lot more research in order to show that it really works. My research in the last 10 years has focused on genome-wide association studies to identify the risk variants for cancer. Genome-wide associations have been particularly successful with the advent of chip genotyping and coupled together with our better understanding of the kind of architecture of the human genome. And then using statistical modelling to put those data together to develop polygenic risk models.